Hi there, I have been requested to do a birth video. I'm not going to go into masses of details, I don't think, but Cassie had requested, so I thought I would just jump on whilst the little one is sleeping. A little bit of a background. So I have had two deliveries. The first one was with Chloe, who passed away after I suffered from an amniotic fluid embolism. It's an incredibly rare and more often than not a fatal condition. It's pretty dang unlucky that it happened to me. Don't know why I said dang. Anyway, so I went in for, actually was going to be doing hypnotherapy or hypnobirthing, and that kind of flew out the window with reality coming in. I did 20 hours labor with Chloe, and the amniotic fluid embolism hit me, and I was unable to continue delivering. I was right at the end trying to push. It was very, very frustrating to me that happened. Well, completely upsetting, and it's very angry, but I still do have a little bit of frustration and anger that, I worked so hard, and it really, really, really didn't go our way. It's a really interesting question because Cassie asked about VBACs. And I'm very sorry, Cassie, but I can't give you any advice or opinion or my own story about VBAC because we had a planned Caesar for Oliver. I fairly soon after Chloe had passed, this is, when we had our 6-week review, and I was, thinking about subsequent pregnancies and deliveries, and I was still kind of like pumped, like, yeah, I can do this. Come on, I can do this. I was really focused. I was really determined. I was really quite stubborn. And there are some doctors that are like, well, this is so unlikely to happen again, so of course you can. I spoke to some people, some families and friends, and one had actually kind of just, why would and how would you do that, And I think it was more about why would you do that to your loved ones, because it's such a risk. Even though we don't know enough about AFE, but, something fatal happens to you, kind of steer clear of it. I did a lot of inner work on this because part of me was going, why the hell would you want to go through that again? That's just insane. And, you could just have a Caesar. I thought about it a lot, and the result of my findings of, the inner me, I really just wanted to have a natural delivery because of my pride, to be very honest. I think that I would have always said to someone, it doesn't matter how they come, and that you just want them to be healthy. But really, I mean, I think maybe it's just because I'm still really frustrated that it was such a fail and such a horrible situation with Chloe. But I really wanted to do it, and I was quite focused on that. But once I realized it was my pride, I just said, well, no, I can't have that. If pride is the only thing that's pushing me to have, essentially a VBAC, and if something were to happen, because something huge did happen to me, and if something were to happen to me again, and a life was in danger, there's two possible people that could die in deliveries. The awful fact of life of deliveries and childbirth is that women still die, mothers still die in childbirth. Even with the best technology around you, the best doctors, they're still dying. It's still reality. Sorry. So once I realized it was pride, I just went, I'm not interested. I brought it up with my doctor. But the hospital, I was going to a different hospital, and because my doctor was moving there, that was the only reason I moved hospitals. They had suggested don't come back to the other hospital only for memory's sake, for psychologically. But I'd already been back like 100 times for follow-up checkups and everything. But anyway, it was a good idea, I think. The hospital basically said, we absolutely would love to have you here. You've got a bed, but you need to have a planned Caesar. And my doctor told me that, and I was a little bit you know, that kind of sucks. And I just said, well, I'm not going to have an argument about it. You know, I mean, essentially, I'm not going to even have a discussion and put forward a case because if someone, you know, with any kind of intellect is telling me, you know, you can't, I would prefer for you in our hospital to have a Caesar, then I'm having a Caesar. I'm not going to, you know, it's not a discussion. I'm not interested. It's, you know, that is the safest, smartest, best way to do it. So I prepared a lot of my head in a way for having a VBAC and just, am I okay with that? And how am I going to feel about that? And how am I going to feel going into a delivery? And once I guess the doctors, well, the hospital had their say, and I had these two sets of minds, I was thinking, actually, it's probably going to be hard enough to have 9 months of what if, even though I have very easy pregnancies. I knew there was going to be what ifs. I knew it was going to be a steep hill to climb. And I didn't want at the end of that to be thinking, oh my God, how am I going to do that? Reality, shit, that's 20 hours potentially of going through that. And no one knows if I'd have the AFE again. Who knows? I was rather content. I was like, actually, you know, I was talking to people, actually, if I just know that that's what's happening at the end, that's what I have to work towards. It's just going to be, you know, it'll just happen. That was one less thing to worry about, for sure. I was never worried about that with Chloe, because I was innocent and I hadn't known that there were, you know, didn't know of anyone like me that had had a very serious issue. Anyway, so coming to the delivery, I was able to originally was able to choose a date, and that then made me feel completely uncomfortable and awkward, you know, because I think for me at least it became kind of, oh, I've been able to do that. I'm feeling really, you know, uneasy about that, and you start getting a little bit, you know, I'm feeling unlucky, and it's, you know, it's almost like you're watching the stars and the moons, and you know, because you have nothing else to hold on to, and you think that, you know, it's just chance, and it becomes very just, you know, I'm able to choose something, well, that's going to turn into something bad down the road. It's just, I think that sometimes that happens. In the end, it was really up to the hospital because they're like, well, no, we don't have that on that day. You'll have to book it in there because that's the only time it works. I'd actually had a very, very minor issue, and they escalated things. And so I had my delivery date bumped up about a week. So I had about 3 days. So I'd finished work and then was in for observation in the hospital, and it was totally fine. And then I had about 3 days at home to put my feet up. And because of how my body and brain work, or my back and my brain, my brain was right, okay, we know that something profound is going to be happening soon. My back just let go, and I actually used a binder. I used Abdomen, and they do binders for lots of different surgical reasons, and I highly recommend it for pregnancy, cesarean, and back pain. So going into it was so businesslike, rocking up at the hospital, doing the paperwork. We were looked after like VIPs. They'd been worded up. We were just looked after so well. We're very fortunate. Pardon me. I need to sleep. I found the whole process of the delivery, it was the best way that they could have done, that anyone could have done, but I still found it very difficult to deal with. Caesars aren't fun, they're not pretty, they're not glamorous, they're not anything like that. I really have I'm very sensitive to drugs, and I had that when I had morphine in ICU after Chloe, and I had intense not reactions, but I felt the drugs intensely, and and a lot of it brought me back to Chloe, and that was really a bit traumatic. It was incredibly intense. It's not an easy thing to go through. I did not automatically go, oh my God, you're the most beautiful thing, and my heart just opened to go, Foo! It didn't happen. I was kind of looking at this baby and just going, I don't know, even one of the doctors had our camera and was like, smile, you might need to smile. And it's like, raging headache, extreme dry mouth. That's fun. Um, the delivery was um, just fine. It all worked, all went tremendously well. They treated me, Dale and Oliver, brilliantly. I think one of the really frustrating things that I found, though, and maybe some advice for people watching this and are planning on breastfeeding, I found it really difficult because every midwife that would come in, they were saying, give us a bell when you have to feed, and we'll walk you through it. And so I did that, but every time a different one came in, they gave me a different set of advice. And so I had 10 different bits of advice to kind of work out, and it got very frustrating. At the end, it was, an incredibly nice midwife, but I said, do you realize I have so much advice? Everyone's giving me different forms of advice, and it's so confusing. And, I got so utterly frustrated by that. But I think it should have been a matter of find what works for you. Just stop listening to them. Go with the flow. I think one of the big things is you have to relax, and it's really annoying to say that. But it wasn't until I really relaxed and really had time with Oliver at home to bond properly. I really had to be quite conscious of that because I hadn't had the time, and I was utterly terrified. First night, I was convinced he was going to, I just had my hand on his chest in the sleep, which is a really bad thing to do because you really need your sleep. We had a really hard start. Well, I did. I just found everything scary. It took me a very long time to wrap my head around things. Yeah, it was really, really hard. I think we kind of, the 6 week mark, everything was just working. Things were just happening, and it was terrific. One of the things that I would still instill earlier, but still not stick to the exact program, and I hope that I don't get into trouble for saying this, but from ages ago, I prescribed to the Save Our Sleep method of routine, but we only use it selectively. But I am very much in favour of routines. I think they're awesome, and we now have a 7 to 7 sleeper, which is magical. And look, I do recommend, I think that, some of the routines are incredibly intense and too much for me, but where I've been able to kind of pick and choose and find what works for us, it's worked really well, so I'm really glad. What else? Sorry, yeah, I would think long and hard if you've had a difficult delivery, and you have the option of having a planned Caesar. I just think long and hard about why you would want to have a VBAC. I know that some probably feel the need to do that for health reasons for the baby, but I can tell you that there are kids that have had normal deliveries and have had, the minor health issues, and Oliver is, a Caesar, and he's not had any issues at all. So I wouldn't be too focused on health issues for the baby. I would think about your own emotional, psychological state and how you think that you might be able to, even just looking at it, in that 9 months kind of, is that going to be a problem for you? Is that going to be a stress? And in that moment, is it going to take you back to a bad moment in your life and questioning things and being really fearful, because we all know that having any kind of stress is, not conducive to labour progressing properly. But yeah, that's kind of my story. We have amazing photos of the delivery, um, uh, and it's really great for me to be able to look back on it now and to have this amazing person. He's an amazing human being, amazing. But to be able to look back at those photos, there are so many photos. It's brilliant. I quite like looking back at them as photos rather than my memories. It was just a really hard thing to be in a surgery, being conscious during that whole thing. I really did just feel the pressure. There was no pain. They did an amazing job, but it's not easy. It's intense. It's emotional. It's hard. And God, I hate drugs. They don't work with me. If anyone else has any other requests about any part of my journey, I'd be happy to share to help another. I will be back soon with some other bits and pieces. I'll talk to you later. Bye.